It is health that is the real wealth and not pieces of gold and silver, is a quote attributed to Mahatma Gandhi. But what are the costs when health, wealth, and race are all tied together? Our guests today say that your zip code, the color of your skin, and how much you earn have a lot to do with your overall well-being. And they're working to change that. Race, poverty, and healthcare, today on Issue at Hand. Welcome to Issue at Hand. I'm Wandy Lawson. When it comes to healthcare, our guest says race and income do matter. About 44% of Georgians identify as people of color, with 30% of those identifying as Black, 8% as Hispanic, and 6% identifying as another non-white race or ethnicity. Blacks and Hispanics are more than twice as likely as whites to live in poverty, and about 240,000 Georgians earn too little to get financial help to buy insurance on the marketplace, and they don't currently qualify for Medicaid. So to find out more about what these stats have to do with health and communities of color, we're joined now by Jemea Dorsey. She is the CEO of the Center for Black Women's Wellness. Thanks so much for being here on Issue at Hand.
Thanks for having me.
Well, I think it might be helpful just to start at the beginning and find out a little bit about what were the origins of the Center for Black Women's Wellness. Why focus on Black women's health?
Well, it's interesting because 30 years ago, actually, this is our 30th year anniversary, we began. We were originally a program of what was called the National Black Women's Health Project. Many may know Billy Avery, who really has been a trailblazer as it relates to Black women's health. And the National Black Women's Health Project was really focused on policy and advocacy issues around why are there so many disparities as it relates to Black women's health. And then they formed us as the program arm of them. And we originally were doing work in public housing in Atlanta, and we were doing self-help groups. And the whole notion was working with underserved women and helping them find their voice, because the thought of self-help groups is really about women have the solutions within themselves. And so based on that community development model, we ultimately began doing direct services, because the very women that we were working with were saying, well, we need healthcare. We need affordable healthcare. We need programs for our young people. And so we began to evolve. And over our 30-year history, we began being much more about actually implementing services with the community, working alongside with them, planning and implementing and evaluating programs that we believed ultimately helped make a difference in terms of improving the health of women.
So this really emerges from the grassroots itself then?
It absolutely does. It's interesting. When I first got to the organization many years ago, I walked into the Center for Black Women's Wellness, which is in a multi-purpose center in the city of Atlanta. So what's unique about it is that it is in the heart of the community, just immediately southwest of downtown Atlanta. And I go into this facility, this neighborhood center, and I see this room full of adults, women and men. And they were having this community meeting about teen pregnancy, of all things. And they were working with the staff at the time at the center. I was not on staff yet. And they were talking about how concerned they were about young people. They were concerned about seeing teens being pregnant, and they wanted to do something about it. And so from that moment on, I was like hooked. I was like, I've got to be a part of this organization because I want to be a part of the solution. And I realized that it's not about what we tell people to do, but it's about something way more organic, that women in poverty and men in poverty, they oftentimes have the answers and the solutions for their communities. And I want to be a part of that and partner with them. So that's why I got there, and I have been there ever since.
Well, one of the elements, I mentioned at the beginning of the show about the access to healthcare based on healthcare insurance.
Right.
It's been over a decade now since really this political wrangling over what form that's going to take. And I'm wondering, from the perspective of people of color and in low-income communities, how is this impacting their access to healthcare?
Well, it's interesting because in the city of Atlanta, obviously we're an urban area. And one would assume that there's a lot of access to care. And there is access from the standpoint of we have plenty of doctors' offices, we have wonderful institutions. However, a lot of times there are barriers to care. Some of it could just be the way you've been treated in the past. And people perceive that as I've been treated poorly because of my race, because I'm poor, because I have no insurance. And therefore, they're inclined not to go back. We had an opportunity being in a neighborhood center to say, well, let's do healthcare differently. For those who may be intimidated by the traditional, doctor setting, you can come here. There's a gymnasium. There are, opportunities in terms of different programs for young people. So nobody even knows why you're coming into this multi-purpose center. There's no intimidation. You're seen by people who often look very much like yourselves and have a similar story. And so there's that kind of disarms people. Also, of course, what's critically important is that healthcare be accessible to all people regardless of income and regardless of insurance status. We know, as you talked about before, that Blacks and Hispanics are the most likely to be uninsured. And in states like Georgia, where we have not expanded Medicaid, unfortunately, that means that we have just, really high uninsured rates of people who lack insurance. But then also, as you also pointed out, those who make too little to get insurance on the exchange, they do not qualify for the tax subsidies that would make it affordable for them to get health care. So they are the ones that we don't talk about, the ones that, everyone assumes if you have a job, you have access to health insurance. And that's just simply not the case. We find a lot of people who come to us, they actually either are working part-time, they're not working, they're self-employed, they're caretakers for their moms. I mean, they're working doing all kinds of wonderful things, but they're not working in a place where they're getting health insurance. And so they oftentimes, they know that there's an issue. They don't feel well. They may already know that they have high blood pressure, but it hasn't been managed in years. And so they know that they need help. And oftentimes with the competing priorities, and you just don't have time to think about going to the doctor until something really goes wrong. And then they find out about the Center for Black Women's Wellness, and they learn that you don't have to have insurance, that you don't have to have a lot of income at all. And so they seek us out. And so to me, it's just been wonderful and transformational to see people who come and say, I've never knew the Center for Black Women's Wellness existed, and I'm so glad that I do now. So it's the stories, it's the people that keeps me going. And it's what makes me feel like it's critically important that we want everyone to have access to health insurance. I mean, truthfully, we would love to work ourselves out of a job. I mean, we want to be there for people that don't have insurance, but we know that we can't be all things to all people. We know that if something catastrophic happens or something happens that is beyond our scope, people need access to care.
Yeah.
And so that's what we're here for. That's what we fight for. That's what we believe in. And we work with a lot of other wonderful organizations and partners that ultimately believe that we need to do everything that we can to make sure people have access to health care.
So you mentioned hypertension. When we think about people of color, certainly hypertension, diabetes, cancer, these are diseases that have a disproportionate impact, but also the outcomes are disproportionately more dire than they are in white populations. I'm just wondering, what is the approach of the Center for Black Women's Wellness to treating diseases and also to wellness?
Yes. So initially, our focus was always on prevention, and we still believe that prevention is obviously the best method. It's lower cost. It costs less for us to try to learn how to cook healthy and to have access to fitness and healthy nutrition. But then we also began realizing that because Blacks are more disproportionately impacted by diabetes, hypertension, that we needed to be part of the solution in terms of helping them manage those conditions. And so we began actually in 2006, we began working with volunteer providers. And so we kind of have a dual method. We have for our women's health care, we use paid staff, mid-level providers. But then 4 times a month, we have a team of around 20 volunteer healthcare professionals, doctors, nurse practitioners, and they provide care at no cost, women and men. So they're able to manage hypertension, diabetes, all those high cholesterol, and around 70% of those that we serve, we're managing for a chronic health condition. We complement the clinical care with all those healthy lifestyle things that we talked about. So the stress management workshops, the healthy cooking. We were doing a curriculum called Cooking Matters, where we're helping people who are we're taking those kind of traditional recipes that we love so much in the South. Unfortunately, me too. And trying to show other ways in which to do it in healthier ways. And so all that stuff is important, the balance between the clinical aspect and the non-clinical aspect to try to improve these health outcomes.
Well, this was one statistic that really stunned me, and that is that Georgia ranks 48th in the nation for maternal deaths and 45th for infant mortality.
Right.
And Black infants are more than twice as likely as whites to die.
Right.
I'm just going to tell you, in the 21st century, that really does stun me that this continues to be a problem.
Yes.
And I'm wondering, what are some of the factors that are impacting these outcomes, and then how are you addressing them at the center?
So where our country has done great is actually, of course, the medical care that babies that are born way too early are able to survive better through NICU and all these medical advances. But the biggest thing that we can do to decrease infant mortality is to improve the health of women before they get pregnant or in between pregnancies, interconceptional health. And so because Black women are more likely to have a chronic health condition prior to pregnancy, that is often one of the reasons why maternal mortality is higher. So again, we're doing a better job with maternal mortality and infant mortality, but it's the health status of women before pregnancy and in between pregnancies where we can really move the needle. So it's really important early on for us to be talking about healthy behaviors. And I say that, we all know that intuitively, but it's not always easy when we're talking about unsafe neighborhoods where you may not feel safe walking, where you don't have really good options in terms of groceries. So we all understand that this is very problematic, that it's not always easy to live healthy. We also, Black women and Black men, in terms of stress, because we're talking about race. And racism there is an impact that we all endure, whether we have, high economic means or low economic means, that there is something that happens to us psychologically by just the burden of racism, how we're treated. That's a stress there that I don't know. There's been a lot of research about it, but I don't know that we've ever really looked at and dissected what that does to us. It eats away at us. And so it often prevents us from going to get resources anywhere because we feel like we have been totally discouraged and we feel like we have been mistreated. There's internalized anger. There are all kinds of issues that I think that the healthcare system really is not equipped to address because so often we're just trying to deal with the symptoms, but we're not really dealing with the root causes. And so I think that there are a lot of issues that we need to deal with to help people really gain optimal health. And there are things that organizations can do, but there's some systemic factors that unless we really address, I think that we're just scratching the surface.
Well, I know you also work with new parents with the Healthy Start Initiative, too. What are some of the things that you're doing with the new parents?
Well, so one of the things that we're doing is that we're identifying women while they're pregnant, early on in their pregnancy. We have a great relationship with Grady, for example, where we have outreach workers who go to Grady, and as women find out that they're pregnant, they tell them about our case management program. Women who are interested, they walk alongside a woman, a case manager. Many of our case managers have experienced some of the issues that these women are dealing with: teen pregnancy, not a good, strong support system, single parents. And so they are working to not only help make sure that they're going to get their prenatal care, but all the other health and social services that are needed, whether it is GED, whether it is workforce development, whether it is housing, affordable childcare for other children that they may have. And a lot of that, what that does is not only is it making sure that you're connecting them to a health resource, but it's these social relationships. It's really removing social isolation. It's having that trusted person who's walking alongside of you. And that makes a difference. That makes, that automatically relieves some stress, right? But it also makes that woman more inclined to have a healthy pregnancy and a healthy baby. So the health outcomes for that program are amazing in terms of lower prematurity rates, lower low birth weight rates. I mean, These moms are doing amazingly well. And they're also coming together in groups and what they call Sister Circle, just to support each other.
So we're going to talk more about this support mechanism. The Black Women's Wellness Center, of course, has services that go way beyond just basic health care. And when Issue at Hand continues, we're going to meet a woman who is part of this wellness community to learn about how body, mind, and spirit are all part of the healthcare equation. Issue at Hand continues right after this.
I wish I was in school.
If only I had a math test today.
I'll stay after class. I'll clean the chalkboard. I wish I was in school.
School ends, but free lunches for your kids don't have to. Find your local Feeding America food bank for help.
We just finished dinner and it was time for homework. He hates homework. I know he's bright.
Why is it so hard for me?
He's
I'm
just
trying
gotta
as
try a
hard
little
as
harder.
I can.
1 in 5 children struggle with learning and attention issues. Go from misunderstanding to understood.org.
Welcome back to Issue at Hand. I'm Wandy Lawson. As we continue our discussion about the impact of race and income on healthcare, we're going to keep talking with Jemea Dorsey. She's the CEO of the Center for Black Women's Wellness, but we're also joined in studio now by Deborah Neely. She's one of the partners here at the center. And, you know, Deborah, because you have come in as a patient, but now are quite an advocate for the center, I'm just wondering how you first became familiar with the services.
Mm-hmm. Well, first of all, thank you for having me. Okay. It's a pleasure to be able to represent the center. I'm not necessarily comfortable being on TV, but when I had the opportunity to do anything to advocate for the Center for Black Women's Wellness, I wanted to take that opportunity. My story is not necessarily what you might typically think of when you think of the center. Originally, I've all through my life had health care, but I found myself in a position of not having health care. And that's a position that I think that anyone can find themselves in.
Absolutely.
It can be because of a loss of a job. It can be because you move. It can be because of divorce and a separation. It can be anything. It can be that you have health care, but you can't afford all aspects of it. And kind of find myself in that scenario. My scenario pretty much started when I started really working for myself. And some of the work that I was doing was reaching out into the community, helping with access. And at the same time, several things kind of came together at pretty much a fork in the road. And that was that I was no longer married. So my husband, who was carrying the health insurance at that time, was no longer there. I started taking care of my mom, who was elderly, who had limited mobility. So it impacted on my ability to work. So as a result, I kind of worked through the raindrops and everything was focused on her. And so as I was not expecting to be in a position or even thinking about that I was going to be in a position where I'd have to worry about health care to the point where I wouldn't be able to afford to take care of it. I felt if I needed to go to the doctor, I'd pay to go to the doctor. I prayed that nothing catastrophic would happen so that I wouldn't have to deal with that. In terms of finding out about the Black Women's Wellness Center, my story is an interesting one because I had a close family member of mine and I was treated through the Black Women's Wellness Center, and I'm happy to be transparent about this, for breast cancer. Okay. And I had a close family member of mine several years earlier who had a lump, a younger person. We went to go see if everything was okay with them, and we got the best of the care for that particular person. They went to the top doctor, who is considered like one of the top-notch doctors in Atlanta for that type of care. So I was familiar from that perspective. When I discovered a lump, I was ready to go back to that top-of-the-line doctor. But just to walk in the door before even being diagnosed, just because I had a concern, it was going to cost $800 before I even knew if I was going to be able to walk away and say, okay, I'm fine, or whether I was going to be in a situation where I had to do something else. So I was really advised by people that I know to do what I always do for someone else. And so what I do is I'm an advocate in the community for students with college access, high school to college transitions. And I'm always speaking and reaching out. So someone said, you need to reach out to people and tell them you need something, which I wasn't comfortable doing. But I reached out to some friends, some people, and they said to me, you know what? You should consider looking at other alternatives. In fact, a doctor who I actually taught her children when her children were very young, I reached out to her and she said to me that you should go to the Center for Black Women's Wellness. And I was a little bit hesitant because I had waited for my appointment with the first doctor. And it wasn't like I discovered a lump one week and went the next week. I had to wait 2 weeks for my first appointment. So when I contacted the center, the first appointment was even further away. And so I was debating whether I should go to this doctor who was top of the line in care and in price, or whether I should go to the Black Women's Wellness Center and come out of pocket and be able to say, you know what, I'm not depleting my savings as aversely as I was in general because I was taking care of my mom. And it was hard for me to make that decision. But what was interesting, I called the Black Women's Wellness Center every day. And every day I spoke to Katrina. And I said, Katrina, I need to come in. I need to come in. If you get anybody who cancels, just let me know. And my diligence worked out. She was able to see me, and they were able to bring me in. And I made a decision, even though it was a few days after the appointment with the other doctor, to cancel with the other doctor and come there. It was just a gut feeling. And that gut feeling was the right feeling.
And so what happened after that? Now, so there must have been a process that made you say that was the right decision.
Katrina was a wonderful advocate from the very beginning. She made you feel comfortable. She made you feel welcomed. Even when she was telling you that it was going to be a little bit while before you could actually come in. There was something soothing and familiar about dealing with someone who was so intuitive, someone who was so connected to your experience. What I ended up doing is coming to the center, which was very different for me, because I'm used to being in private doctor's offices where everything's shining and everything looks a certain way. And I was walking into a community center. And usually when I'm walking into a community center, I'm walking into the community center because I'm there to help service someone.
Right. This is a whole other position.
Absolutely. So it was very, very different. And so when I got there, I go upstairs and I'm like, this is a little bit different. But by the time I was welcomed in the door, from the very first moment, it was apparent to me that I was in the right place. It might not have been the fancy place, but it was the right place. It was beautiful. It just was different than my experience. When I got there, I was welcomed in, I signed in. I knew that I was going to be able to afford this visit, and I wasn't going to have to worry about depleting funds in case there was something that they were going to diagnose down the road. I was seen by a nurse practitioner. I was also seen by a nurse. I was seen by a family care connection worker who kind of walked me through the process. When I got there, and I actually had my exam, and I was sitting there, and they said, well, yes, you do have a lump. I was like, yeah, I know. But I was thrilled to know that they had a partnership with Emory St. Joseph's. And through that partnership, I was able to be treated. Emory St. Joseph's is a facility that's in my neighborhood. I live in Sandy Springs. And so I'm not usually in the inner city of Atlanta. And the connection that they had with this particular facility was phenomenal, because what it actually did was it walked you through every single step. And that's important. When you are looking at a major diagnosis for something that is very, very different, you don't have experience, you need to be able to be ramped up very, very quickly.
Yes. Well, Deborah, you look great. So it's apparent that the care is obviously has been paying off for you.
It's been excellent.
That's wonderful. Jemea, it may go without saying, but, the care at the Center for Black Women's Wellness is not just for Black women. And it also appears that it's about more than health care as well. So how would you describe that?
It is, and it's true. We serve largely Black women, but certainly not all Black women. We say women, folks come through our doors from all walks of life. You talked about you live in Sandy Springs. You have worked in corporate America, there are folks that come to us that just from all parts of metropolitan Atlanta, women, men, Hispanic, white, Black.
I think that's important to
they're
know.
looking for affordable health care, and they find out about us. And so it warms my heart to hear your story, and I'm so grateful that you had a great experience. And some of the other things that are just so critically important when we think about health is not only the physical health, but of course the mental, emotional health, and even financial health. We do a micro-business training program for women, many of whom had, worked and had great careers, and when the economy crashed, and it was hard for a lot of women of a certain age bracket to get back into the workforce. And that became their opportunity to finally say, well, I want to start a small micro business. And so we look at all those issues that disproportionately impact Black women's health. And that's economic, through our micro business program, but also mental and emotional. We partner with Odyssey Family Counseling Center, and they do individual therapy once a week. That happens during our clinical hours. So it's wonderful. Women or men do not have to come multiple times for a variety of different services. They can come for their physical health care, and then they can go talk to the therapist. So I think all these factors coming into play, looking at the health of a woman during her entire lifespan, starting as early as possible when, these services can yield their biggest benefit. And so I'm just really, really grateful. Clearly, I enjoy working there. I've been there for a long time. And it warms my heart because I just want everybody to be well. And it's a journey for all of us. And I think that when we can find organizations and providers and people to help us on that journey, then it's a win for all of us.
Absolutely agree. So for those who want to learn more about the Center for Black Women's Wellness, what should they do?
Yes, they can connect with us on social media, Facebook. We're fairly active on Facebook. Our website at cbww.org. And then, of course, they can call us at 404-688-9202. But check us out, Center for Black Women's Wellness, and we'd love to be a part of your wellness journey.
Thank you so much. Well, Deborah Neely and Jemea Dorsey, I want to thank both of you so much for coming in, sharing your stories here on Issue at Hand. And of course, I want to thank all of you for joining us as we were shedding light on the topic of race and poverty in healthcare. I want to thank you for being a part of the Issue at Hand conversation. It continues online at AIB Studios on YouTube, Facebook, Twitter, and Instagram. I'm Wandi Lawson. I'll be with you next time for Issue at Hand.